This is David Tafoya. His father Joshua says since he was 18 months old, David has suffered from a severe case of epilepsy. Status epilepticus is an intense neurological and medical condition with a high mortality rate. It's characterized by prolonged seizures.
The thing that causes damage is usually the, stop breathing part or lack of oxygen to the brain from the seizure is usually the part you have to watch out for. And in David's case, because they're so prolonged, there's a larger likelihood of a complication to occur.
There is no child neurologist accepting Medicaid in Las Cruces, New Mexico, where the Tafoyas live. So when David has had problems or needed checkups, he's seen a neurologist in El Paso.
There's been instances where he's had a seizure that lasted an hour long, even after we've administered all the treatment. So we'd have to be transferred to El Paso Children's to get treatment and basically get the seizure to even stop.
After 2 years of fits, trauma, and a run of different medications, their neurologist managed to stabilize David's epilepsy, giving hope for a normal life and his parents Carrie and Joshua some peace of mind. But the trauma has left David suffering from PTSD. His mother Carrie says it's been hard to get him to go to the doctor.
He used to have huge screaming fits, hide under the table, refuse to come out, was terrified of being around the neurologist, going to the doctor in general. And over the last year, he's really come around to being, being around his current neurologist. And he knows him, he remembers him, he's comfortable with him.
With a comfortable doctor-patient relationship built over time, David went almost 2 years without a seizure. But the Tafoyas are concerned they may have to start all over again with a new neurologist, as David's current one announced he will no longer see him. The New Mexico Health Department has reduced reimbursement rates to Medicaid providers, citing a $400 million gap between the program's costs and available state revenue. With these lower reimbursement rates, some providers have stopped seeing New Mexico Medicaid patients. Carrie Tafoya says they're going to have to travel all the way to Albuquerque for their son's treatment and even just checkups.
It's already difficult because kids don't like riding in cars for a long time. So now we have to go to Albuquerque, which means 3.5 hours, which is 4 hours round trip, which is going to be hard for them to stay in the car. And that's a lot of screaming.
That means paying for gas, hotel, and parking expenses. The Tafoyas can get the state to reimburse them, but that's concerning to State Senator and Legislative Finance Committee Chair John Arthur Smith. He says whatever funds the state is going to save on Medicaid cuts are likely to be eaten up by travel expenses.
They're penny wise and pound foolish on that. They're not saving money. And then if you really have the client's best interests at heart, quite frankly, I challenge that thought process when they don't take advantage of the closest provider.
Smith says he has flagged the issue with the State Department of Health for review. He says access to care should be simplified and kept nearby for patients like the Tafoyas. Currently, the Medicaid expansion under the Affordable Care Act is fully funded, but starting in 2017, states will begin contributing to the cost. By 2020, states will fund 10% of the expansion, with the federal government paying the other 90%. Smith says the fact that New Mexico can't cover the remaining 10% underscores the need for funding sources more reliable and diverse than oil and gas revenues. The Tafoyas say worse than having to travel all the way to Albuquerque for care is being left in limbo without a neurologist while their son's patient referral is being processed.
I'm assuming we probably won't see anybody for 3 months, which means we're going to go that entire period of time without having anybody to call to ask, if he starts acting strangely. He's on some fairly intense medication that does have side effects that include possibility of depression and in extreme cases like suicidal ideation and stuff like that. So it is serious medication. And he, hopefully nothing will happen and it will all be fine. But if something did happen, we basically have no one to call.
Making things even more difficult for the Tafoyas, according to UNM Health Sciences data, there is only one primary care physician for every 1,099 New Mexicans, and the number of medical specialists like neurologist is well below the national benchmark. For KRWG, I'm Simon Thompson.